Hi, I'm Louise. I'm the dental hygienist here on 3 Dental in Angel Street. A lot of people can be quite confused about the differences between a scalp polish, a deep cleaning or periodontal treatment, and I'm hopefully here today to help kind of clear up a few things for you. So what a scalp polish is by basically removing the hardened tartar off the tooth surface that you can't remove at home by using an ultrasonic cleaner which vibrates to remove the tartar off the tooth surface. Then afterwards, what we would do is we'll polish your teeth to remove the soft plaque and also any staining on the tooth surface as well. What a deep cleaning or a periodontal treatment, which is the same thing, it's by going underneath the gum line and cleaning out the tartar and the bacteria that's formed on the root surface of the tooth. If it's not fully removed, what could happen is that bacteria, which is the tartar, can also start to eat away at the bone around the teeth, where eventually over time the teeth can become a bit loose and fall out. The periodontal treatment is performed by your dental hygienist, a periodontist, which is a specialist in gum treatment, and also by a general dentist as well. But ultimately, you would normally see your dental hygienist if there's a dental hygienist in the practice. And if the case is very, very severe, we'll refer you on to the periodontal dentist to look after your gums. When you come into my chair, first thing I'll do is I'll assess the gums. What I'm looking for in around each neck of a tooth, there's a flap of gum that doesn't fully stick to the tooth. This is known as a pocket. What happens is bacteria falls underneath the gum line, causing the gums to become inflamed and bleed. And that's when gum disease starts to typically form. What I do is I'll measure the pocket to see whether or not they're in a healthy stage or a disease state. Gum disease is very common in patients. Up to 80% of the population worldwide have gum disease. So the cleaning itself doesn't hurt because you're going to be numb throughout the treatment. But afterwards you might feel tenderness around the gums, but it's a very gentle procedure and it shouldn't necessarily hurt. A deep cleaning could take anywhere between 45 minutes to about for a couple of hours. It really depends on the severity of the case. You may need 2 to up to 4 sessions. After we do the deep cleaning, the gums will reattach back onto the tooth again. So typically for aftercare, just make sure that you're brushing into the gum line, cleaning in between the teeth every single day. Just no alcohol for 24 hours, no hot teas and coffees as well, or any hot foods or drinks, just because that can thin the blood. No heavy exercising as well, because again, that can pump the blood and encourage bleeding. We don't want that to happen. If you notice that you may have bleeding when you brush your teeth, or bleeding when you floss in between your teeth, or if you feel you have any looseness, you have any bad breath, or a bad taste in the mouth, you should definitely come in to see your dentist first to get an exam and just check the gums. They'll be hopefully able to refer you on to the dental hygienist, who will be able to help kind of treat and prevent your gum disease from forming. If you'd like to book an appointment, please head to our website at 3dental.ie.